Folks, if you're just now joining us, we have breaking news. The numbers are out from the Congressional Budget Office when it comes to how much the new health care plan would cost and how many Americans could stand to lose their health care. This is the Repeal and Replace Obamacare initiative there, headed by the Trump administration. Nancy Cordes is on the phone with us now. Nancy, this report just came out. What do you make of it?
Well, we're just going through it, DeMarco, but there are some really eyebrow-raising numbers. The Congressional Budget Office, which is nonpartisan, has determined that under this GOP alternative to Obamacare, 14 million people would be uninsured under this legislation just in 2018. 14 million more people than you would see if the current health care system was left as it is. And that is just in 2018. Then when you get to 2020, that number would rise to 21 million and then 24 million in 2026. So basically what the CBO is determining is that all of the gains in coverage that were achieved under Obamacare would essentially be wiped away for a couple of reasons. First of all, because the GOP alternative does away with the individual mandate. It no longer places government penalties on people if they don't buy insurance. And so the CBO predicts that a lot of healthy Americans who perhaps weren't getting insurance before Obamacare became law would go back to not having insurance again. And then the CBO estimates that that big rise in the uninsured in the out years, 2020 and beyond, is due to the steep cuts that the GOP's plans would impose on Medicaid.
So if you could go through those numbers again. You said 14 million would be uninsured by 2018. What's the number in 2020 and then 2026?
So keep in mind, this is a comparison to what would happen if you did nothing. So this is 14 million fewer people who would have coverage in 2018 as a result of this GOP plan. And the CBO says that's partly because of the individual mandate going away and partly because penalties would increase. And that's very interesting because Republicans have been arguing that their plan would reduce penalties. So I'm eager to read through this report a little bit more and find out why the CBO thinks that, at least at the very beginning, that premiums would go up. But then the number of people who would be uninsured under this legislation compared to current law goes up to 21 million in 2020 and then to 24 million in 2026. And at that point, and keep in mind, there are people out there who, despite Obamacare, still aren't covered. In fact, one of the criticisms of Obamacare, particularly by Republicans, has been that it didn't succeed in covering everyone, although it did succeed in adding tens of millions of people to the rolls of the insured. But this CBO analysis finds that by the year 2026, an estimated 52 million Americans would be uninsured, and that is greater, frankly, than the number of Americans who were uninsured before Obamacare was enacted into law.
All right, Nancy, a quick question for you. How do you think this is going to fare amongst the Republicans who have spoken out against many revisions planned for this seemingly health care plan here, especially when you look at the division in the GOP?
Well, for the Republicans who were arguing that they were concerned about the plan because they thought that it was going to leave more people uninsured, yes, this is going to be a huge red flag for them. It's going to be a big concern, and it really runs counter to what the president has been promising, which is that everyone is going to get covered. It's going to make it much harder for him to wholeheartedly embrace this bill, as he has been doing as recently as today, when he sees these numbers that show that actually the opposite is true. However, for conservative lawmakers who have been arguing that this is Obamacare light, that it's still too expensive, that it's still a big government, there is going to be something in this report that they like, which is that, according to the CBO, this legislation would reduce the federal deficit by about $337 billion over the next 10 years. And that is due primarily to the cuts in Medicaid. And so that's a figure that is going to be very pleasing to fiscal conservatives. Whether it will outweigh the the big reductions in coverage remains to be seen, especially because even Republicans who maybe weren't big fans of the expansion in Medicaid, they all know that it's possible that they could be punished at the ballot box if large numbers of Americans lose the coverage that they've come to rely on.
And Nancy, I know you just got your hands on this report, as did we as well. It looks like it's pretty clear when it talks about the effects on the federal budget, the effects on health insurance coverage, also the effects on premiums when you look at just the first couple of pages. What's next after receiving these numbers here?
Well, the Speaker of the House, Paul Ryan, is going to be doing an interview on Fox in a couple of hours, and that will be our first chance to see what he thinks of these numbers. And now we wait to see how Republicans react. We know how Democrats will react. They will say that this is Republicans pulling the rug out from under hardworking Americans, that this is exactly what they predicted, that Republicans are trying to rush through something that is kind of half-baked. But the real question is, do Republican leaders say, okay, we see these numbers, we'd like to tweak it? Will they discount what the CBO finds? You already saw a full court press by Republican leadership and the administration over the weekend to say, well, CBO isn't really very good at crafting these numbers, and we think whatever they come up with, it'll probably be wrong. So will they just try to dispute what is encapsulated in this report? And frankly, how much blowback will they get from their own Republican members? That is going to be really the defining factor at the end of the day. If they think they can't get enough Republican votes in the House to pass this, then they're going to have to go back to the drawing board.
But again, the CBO is a nonpartisan group, right?
That's correct.
So,
and
yes.
Actually, it's hard for Republicans to criticize this finding, because actually the person who runs the CBO was selected by Republicans. He is conservative. So the party in power does have the luxury of choosing who runs the Congressional Budget Office. But yes, the CBO is supposed to be sort of the referee when it comes to legislation that's put forward by the right and the left. They just crunch the numbers, and as best they can, and they will acknowledge that this is an inexact science. You know, you can't always predict human behavior and how people will react to the elimination of an individual mandate. We've never had that experience before. So they're basically, they're using their best assumptions to come up with this number, but that's really the best we've got. And interestingly, this looks like an even greater loss of coverage, according to the CBO, than what some independent analysis had predicted in the last week and a half or so.
Now, Nancy, we just finished looking at some pictures that were poured into our studio here, where the president just recently signed an executive order and did not mention anything about the CBO numbers. But earlier, during White House Press Secretary Sean Spicer's daily briefing, he was asked about the CBO numbers and asked specifically, are they legitimate? He says that the numbers were off by 50% for the numbers of those insured. What do you make of that?
Well, Republicans have been arguing, look, the CBO was off when it came to predicting how many people would be covered by Obamacare. Therefore, how can we trust the CBO's numbers this time around? And it is true that the CBO predicted that there would be more Americans covered by now under the ACA than there are. But they weren't off by a tremendous amount, especially when you consider that when the CBO originally looked at this legislation, they assumed that all 50 governors would expand Medicaid as was offered under the Affordable Care Act. In the end, only about half of the governors took that opportunity, and so that affected the CBO score. That's something that was not knowable at the time. And what Republican leaders will probably argue here is that the CBO is not taking into account the fact that their plan unleashes all of these market forces, and it encourages competition and all kinds of plans that wouldn't have been available under Obamacare, and that eventually that will drive prices down and that will get more people to buy insurance. But you even heard conservative Tom Cotton of Arkansas say this weekend that he knows that that's the goal, but he doesn't think that the bill does enough to really achieve that goal. And so, the worry here is that the bill, doesn't do enough to cover people the way Obamacare did, but it also doesn't do enough to create competition either, and that it's sort of like stuck in this middle ground that doesn't do anything very well. That's at least the concern among a growing number of moderate Republicans, including Darrell Issa of California, who was another member who said this weekend he can't vote for the bill as it's currently crafted, and he's pushing for changes.
All right, Nancy Cordes, you are on it. We know you got to get ready to file for Evening News, so thank you very much for that report. Again, folks, if you're just now joining us, we are just now getting those numbers from the Congressional Budget Office, CBO numbers in regards to what would happen if the Obamacare plan was replaced. Indeed, that's the goal for the Trump administration and also for the GOP there. And just speaking to Nancy, she said if you did nothing, 14 million people would be uninsured by 2018. That number would rise by 2020 to 21 million. And then by 2026, we're talking about 24 million people who would possibly be uninsured. That's if you did nothing.